My name is Robel Mishu. I am the WASH program manager for World Vision Ghana. The World Vision WASH program started long ago, around 1985 in Ghana, and we have been part of celebrations, some of the celebrations that have been discussed in this room today, like the elimination of Guinea worm from this country and then the others. So we involved in the area of provision of safe water, sanitation, and then hygiene and behavior change services to the people and children of Ghana. And doing so, we believe we cannot do everything alone, but we work with other partners. They are like-minded partners who have the expertise, who have the knowledge in the various areas. So we work together, and as you have noticed, is more into WASH in healthcare facilities. Our work in these 6 districts within those 2 regions of OT and Upper East have revealed a lot of information, a lot of gaps in terms of access to water, access to sanitation, hygiene, healthcare waste, and then so many other domains of intervention. So we believe we have triggered an important conversation today, and we believe that in collaboration with the partners that are here or that have been here, we will be able to come up with plans that are valuable to change some of these situations. We have done similar engagements in the 6 districts in the previous few weeks, and every information, including the plans of action that came up at district level, indicates that our situation is not encouraging. Definitely we need to do something as partners to change the situation in our healthcare facilities in this country.
By the WHO UNICEF. It was recently revised in 2021, so it is that revised version that we used to assess the healthcare facilities. We also employ direct observations in order to maximize objectivity. So for those of the indicators that were physical, we're looking to see the presence or absence of this water and sanitation teams, because these 2 organizations are key players when it comes to WASH in healthcare facilities in these districts and every other district for that matter. We also had a summary of what the WASH tool entails. It has 7 domains. The revision came with 7 domains. Here they told there were 4 domains, which you can call the traditional WASH areas, categories, if you like. So previously we had a domain largely on water, sanitation, healthcare waste, and then hand hygiene. The revision is further broken it down and extended it, and we have environmental cleaning, management and workforce, and also energy. For the domain on water, it basically looks at indicators when it comes to access to water and also water quality of the water as well, was managed thereof. Hand hygiene, basically on hand washing and related indicators. Environmental hygiene, we looked at the supplies available for cleaning at the healthcare facility level. We also had management and workforce. This has indicators that concern the personnel, their capacity, and the frequency at which they were giving any sort of training when it came to IPC, WASH, or cleaning. That talk about whether health facilities have access to any kind of electricity source, and for instance, latrine facilities lit, they have lights, because we know at night whether it's lit or not, it can encourage or discourage use. So it has indicators concerning this. Altogether, the WASH tool has over 90 indicators. And we collected data on about 74 of these 90 indicators. And if we are going to present the findings on each of those indicators, someone will say it is not today matter. A few of the things that we have done already, very key among them was the ethical approval, which we sought from the Nabongo Health Research Institute. They gave us feedback on our work concerning our proposal, the ethics and all of that. We went back, firmed it up until we got the approval to proceed. Initially, when we began, we were working in 5 districts. 2 in Upper East, that is minus Busa South, and then the 3 we have seen already in Oti region. We wanted to be able to reach at least 200 healthcare facilities. At the time, the secondary level data we had was totaling to 200 healthcare facilities in the 5 initial districts. However, upon validation of those healthcare facilities, we had lesser than 200, and it was an opportunity for us to bring on board another district. And the health centers followed not closely with 27, and then the hospitals were 6. Now we'll talk about water. For this indicator, it's on an improved water source is piped into the facility. Now the category, the wash tube breaks it under, starting from the blue at the bottom, it means no improved water source is accessible on premise. So they may be relying on an improved water source, but it is not on the premises of the healthcare facility. It may be a community borehole, a community standpipe that they go to and get water. It may also be an unimproved source that is available on premise. All those kind of scenarios fall under the blue. So let's look at how the results fare. We will see that generally majority of the healthcare facilities had basic access to water or had an improved water supply that was accessible on premise, but it wasn't piped into the facility, and for that matter, caregiving areas. Or less than 10 most probable number, but E. coli was present. Now, a risk of contamination assessment was equally done. Now, this risk of contamination looks at whether there was a latrine facility within 20 meters from the water source. Was this latrine facility on an elevated land compared to the water source? Is there a dam site close to the water source? And other indicators that can signify risk of contamination. Now that results came out largely okay, because 11% of the water points rank as medium risk of possible contamination. And however, it was highest in Kasna Nankana East, where 30% of the sampled water sources had a medium risk. And then I wanted to relate this particular 10% medium risk, which was the highest. If you compare the 30% to the 11%, which is the average, you see that it was quite high. It was facility, and this also has a correlation with the levels of contamination we are seeing with the source drinking water in the previous slide. Comparing this to similar data available in the WaterAid work in 2015 as well, it also discovered that 52% of healthcare facilities have no toilets in the Bongo and Kasna West districts. And also in the JMP, only 2% of health facilities in rural Ghana have basic sanitation access. Now it's interesting, in this report there was no data for the urban areas, there was rather data for the rural areas, and so there is data available for global. Who is responsible for maintaining the latrine infrastructure, the water infrastructure in the healthcare facility? Who is responsible? Healthcare waste management. This indicator looks at functional waste collection containers are available in close proximity to all waste generation points for general waste, infectious waste, and SHAP. So this looks at the availability of 3 different waste containers for disposal of waste, of the three kinds of waste that is generated at the healthcare facility level. So we are saying that we should take advantage of low hanging fruits. Basically, the point we want to make here is that for some of those indicators, when it comes to the financial commitment to those, is relatively lower than others. So for the indicators that is lower to achieve in terms of the funding, we can focus on these if we are funding challenged. For instance, there is an indicator on hand hygiene promotion materials. I told you we have over 74 indicators. We didn't share all of that. So there is an indicator on hand hygiene promotion materials being displayed and visible in all wards or treatment areas. So these become like nudges and reminders to health staff and patients to wash their hands periodically. And so this compared to, for instance, providing mechanized water facilities for the health facilities that do not have water, you will see that the money that will go into this is definitely less than. So as we plan to do the big things, there are low hanging fruits that we can plug that will go a long way to.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.